Can hip replacement surgery last 30 years or more? The answer might surprise you if you are considering a hip replacement surgery at a younger age. Hello friends, I'm Dr. Pankaj Walecha and I'm a hip and knee replacement surgeon in New Delhi, India. Over the last 20 years, I've helped 10,000 plus patients in living their normal lives by treating their hip and knee problems. Well, scientific research has shown 80 to 90% of the patients are doing well at 20 years after the surgery. 58 to 60% patients are doing well even at 25 years, which is a fantastic number. It encourages both surgeons and patients to consider this surgery more and more. But what are the key factors in making this surgery last for such a long time? Number one is the age. If you are younger, then you're likely to put more stress on your hip joint. Number two is body weight. If your body weight is higher, then you put more load onto the joint and which can make it wear faster. Number three is activity level. People who get involved in high impact activities on regular basis also put more load onto the hip joint. Number four is implant material. I always insist that every patient, wherever the patient is in India or outside India, you should insist on getting US-FDA approved implants which are of top quality, which have stood the test of time. And in today's world, we have fantastic implants which have history of lasting for 30 years or more. These are one of the best implants available to us, which we can offer to almost all our patients. Number five is surgical technique. If your surgery is done through a conventional approach, or if your surgery is done through a minimally invasive approach, or through a mini posterior approach. We do more and more minimally invasive surgery by direct anterior approach and mini incision posterior approach, in which either the muscles are not cut or very few muscles are cut and they are repaired back. So that allows me to give my patients liberty of living a life like a normal person without any major lifestyle restriction. And number six is the placement of the implant in your body. If your implant has been placed at the right place for your body at the correct angles, then hip replacement surgery is going to last for a very long time. So these are the key factors which can affect the life of your hip joint. So can it last for more than 30 years? Well, the answer is yes. And as we are using more and more modern implants, ceramic on highly cross-linked poly bearing surfaces, it is no longer rare. I also see patients who were operated in their 40s, were operated by previous surgeons, and now they come to us for follow-up in 70s. So if those implants which were put 30 years ago can last for 30 years when the surgery was performed well and when the patient was taking good care of the joint, then in today's time, the implants which we are using may last even more than 30 years. So the hope is definitely there, and we hope to make these implants last longer and longer. Total hip replacement surgery, when performed using a good surgical technique and a good implant, then it is a long-term solution to your hip pain. So you should definitely consider it if you qualify for it. My best wishes to you.